Welcome back. Monoclonal antibody therapies have been key in fighting against severe illness and preventing death after becoming COVID-19 positive. But the therapy has come under scrutiny due to more people needing the treatment, as Tennessee's COVID-19 positivity rate remains one of the highest and supplies are becoming limited. As we continue our day-long special reports on moving the needle, News 2's Gerald Harris looks at how the state is using the treatment.
Monoclonal antibody therapy for COVID-19 is a synthetic protein that's infused in patients via an IV and not a foolproof option for everyone.
And so the antibody's been showing in high-risk individuals, so folks who are truly at risk of getting severe disease. It decreases the rates of hospitalization up to 70%. So that's great, but 30% of folks, despite the monoclonal antibody, will still get sick enough that they require hospitalization.
But the treatment, which is being used under emergency use authorization, has shown to be effective.
It is particularly helpful in folks who either haven't been vaccinated or who may not have mounted an adequate antibody response because of problems, underlying problems in their health that may limit their immunity.
But antibody supplies have shortened in Tennessee as the Delta variant gripped communities across the state. The Department of Health announced distribution of the treatment could be temporarily reduced, prioritizing those who need it first.
As the supply of antibodies has become more limited. So there are certain underlying medical conditions, certainly patients who are immunocompromised, elderly patients.
Doctors say in order for the treatment to be effective, the sooner the better.
That's sometimes tough because a lot of times patients with onset of symptoms don't get tested immediately. And it's really not from date of positive test, it's from date of onset of symptoms. So sometimes it's a little bit of a crunch trying to get folks in within that 10-day window.
Doctors also say the monoclonal antibody therapy should not be used as a substitute for vaccination.
They are not interchangeable. We would not recommend counting on the antibody to protect against hospitalization. The vaccine is given truly to prevent infection or prevent symptoms of infection. And so it's given as a prophylactic agent.
Altogether, the treatment takes about 2 hours.
Then the product itself is infused over a 20-minute period. We monitor folks for an hour after the infusion is complete, and that's because there is the small possibility of an allergic reaction.
Treatment locations can be found on the Tennessee Department of Health's website. Currently, the website lists nearly 40 available places to get the antibody infusions across the state. In Nashville, I'm Gerald Harris.
Now, the monoclonal antibody therapy is free. It is paid for by the federal government. Coming up